Dry needling. It sounds intense, right? Tiny needles going into your muscles, and it raises a lot of questions. In this video, let's break down some of the basics. What is it? What does it do? Why do we use it? And just as importantly, why wouldn't we use it? Let's make it make sense. Dry needling is a technique used by a physical therapist using a thin, solid needle to target specific spots in a muscle. Usually we're targeting trigger points or tight bands or irritated areas. It's called dry because there's no medication or any type of injection, just the needle. It looks similar to acupuncture in the needle that's used, but the reasoning is pretty different. Instead of thinking about meridians or how energy flows through the body, we're thinking about how do muscles and your nervous system function. Essentially, we're trying to reduce pain or improve mobility or just improve how you can use your muscles. So what's actually going on in your body when we needle a muscle? Well, let's take a look at the basics. There's a local twitch response. That jumping or twitching feeling that you feel when the needle hits just the right spot, well, think of that as your nervous system resetting that area. There's an increase in blood flow. In fact, some studies have shown that for up to 15 minutes after being needled, the entire muscle can have up to 72% more blood flow. And more blood flow means more oxygen and nutrients being delivered to that muscle. It also has neurological effects. That means it can change how your nervous system is interacting with a specific area. That can mean either upregulating or downregulating how much attention your nervous system gives or how much tone is being held in a muscle. This can be especially useful in cases of chronic pain where certain muscles or areas are guarding a spot. In short, it changes the environment around a muscle or an area so that it can heal or move better. So, with all that being said, why would your physical therapist actually pull out the needles to use them? Here are a couple of big reasons. It can reduce tightness that's limiting movement. Think about someone with a locked up hip who might have been doing all the stretches in the world without any improvement. Needling could get that neurological reset to improve mobility when you otherwise couldn't. It can assist with tendon issues. For example, someone who has Achilles tendinopathy from miles and miles of running week after week after week. Oftentimes, we see this because the calf muscles are working too hard to do too many jobs. They're trying to propel, but also stabilize the ankle. If you needle those muscles that help stabilize the ankle better, it can reduce how much work the calf has to do and reduce how much strain there is on the Achilles tendon, allowing it to calm down over time. It can also improve movement quality. Think about someone who has overactive or tight or painful upper traps. Needling the upper traps can help reduce some of that activation. Then following that up with activation to the lower traps and serratus anterior can improve how those muscles coordinate together and improve the overall quality of how your shoulders move. Notice how in all of these examples, needling doesn't solve the problem. It isn't a cure-all. What it does is open up a window where your body can move differently. In that window, you can train it to move differently, and therein lies the power. But dry needling isn't for everyone. So here's when we typically won't use it. If you're not comfortable with needles, there's more than one way to attack any given issue. And what's the best sign that something is going to work is if you're comfortable with it. So if you're just not a needles person, we're going to attack your issues in a different way. If the issue is more about strength, needles aren't going to build muscle or strength. It's a tool, not a shortcut. Or if there's a medical reason not to. This may include bleeding disorders, you're on certain medications, you're in certain time periods of pregnancy, or there's an infection near the site of needling. We always do a thorough screen to make sure that it is safe for you. Just as important, we skip it if we don't need it. If everything else we're doing is working, other manual therapies, exercises, all of that is making progress, why add an extra step? So Should you try dry needling? Well, that depends. It depends on your body, your goals, and what you're dealing with. For the right person, it can reduce pain, improve mobility, and jumpstart better movement patterns. If you're curious about if it's right for you and you're in the Denver area, let's talk. Let's see if it's a good option for you and your treatment plan, or if something else might work better.